If I were to suggest that we had a system issue that was increasing medical errors, undermining quality of care, decreasing patient satisfaction, decreasing access to care, and that it was such a pervasive system problem that in some form or another it might impact up to half of the patients being cared for in our hospitals and clinics today, you can imagine how we would respond as a system. You can even imagine how our legislative bodies, our governing bodies, the population would demand that we rapidly evolve to address that challenge. And what I would suggest to you is we have precisely that type of a system issue. It is having exactly those consequences that is well established with good science, and we've known about it, but we haven't responded to it the way we would other system issues with those consequences. And that challenges burnout in healthcare workers, but most specifically in physicians, and that is where the problem is most acute. First look, all specialties, all practice settings. And you note that 45% of physicians in the US had at least one symptom of severe burnout at the time of that study. Wide variation across specialties, and I think concerning to many that many of the disciplines really at the front door to our healthcare systems, family medicine, general internal medicine, emergency medicine, among the high-risk groups. You're all familiar with the CMA's most recent study in 2017, and 30% of Canadian physicians at that snapshot were experiencing burnout. Equally, perhaps even more disturbing, 8% of Canadian physicians had considered suicide in the last 12 months. We collected data in US physicians in 2017 as well. It was 6.5% in US physicians, so a little bit higher in Canada than in US physicians. And when we simultaneously collected data on the general US workforce, higher risk in the physicians, even after we adjust for all factors. Few of those with distress were seeking help, and you note that there are some stigma and structural barriers that are barriers to help.